Assistant Professor from SNS College of Physiotherapy. Today I would like to share about hypertension since it is the month of May. May 17, 2025 has been celebrated as World Hypertension Day. I would like to share some stuff about hypertension. So this is nothing but a pictorial representation of hypertension in which the blood is flowing through the artery, in which certain pressure is exerted by the blood in the arteries. That is the upward and downward arrows of the blood in the arteries. So the first one we're going to see is definition. It is nothing but hypertension is also known as high blood pressure. It is a long-term medical condition in which the blood pressure in the artery is elevated persistently. And so what is blood pressure? So the normal value of blood pressure is 120 by 80 millimeter mercury. Whereas so when we call it as a high blood pressure, so the level of high blood pressure is the systolic blood pressure should be above 140 and the diastolic blood pressure should be above 90. In this case, we will be calling such blood pressure as high blood pressure. So coming to the types, it is divided into three types. That is pre-hypertension, in which the patient will be experiencing the systolic blood pressure around the value of 120 to 139 millimeter mercury, whereas the diastolic blood pressure would be around 80 to 89 millimeter mercury. And the second one is the hypertension stage 1, in which the systolic blood pressure would be 140 to 159 millimeter mercury, and diastolic blood pressure would be 90 to 99 millimeter mercury. Whereas in hypertension stage 2, the patient will be experiencing the systolic blood pressure would be equal or more than 160 millimeter mercury, and in diastolic blood pressure the blood pressure would be more than 100 millimeter mercury. And sometimes the gestational hypertension will also be present, that is pregnancy induced hypertension. So these are the types of hypertension. Yes. Coming to etiology. So what could be the causes of hypertension? That is an interesting one. So primary hypertension, it is an elevation in the BP without any identifiable cause. That is said to be as primary hypertension. So what is secondary hypertension? So it is nothing but elevation of blood pressure with an exact cause. There will be some exact cause will be present. So this accounts for about 5 to 10% of the total cases. So the causes of secondary hypertension would be congenital narrowing of aorta. This is seen in some cases. Majorly renal diseases, endocrine diseases like Cushing syndrome, and neurological disease like brain tumors, head injuries, and sometimes sleep apnea could also be the cause of hypertension. And whereas in some cases medications like oral contraceptives, pills, NSAIDs, and cocaine will also induce the blood pressure, and sometimes cirrhosis of liver also plays a major role in the causes of hypertension. Yes, next, coming to the risk factors. What could be the risk factors of hypertension? So the first one is age. So aged people, that is old aged people, are more prone to hypertension comparatively to the young people. And alcohol, smoking, diabetes mellitus, and excessive intake of sodium, that is dietary intake of sodium, and gender, family history, obesity, sedentary lifestyle, and stress also plays a major role in hypertension. Yes. And coming to the clinical features, so what is the clinical features that is experienced by the patient who is affected by hypertension? That includes sometimes high blood pressure does not cause any symptoms because it is since it is also called as silent killers, and in some patients the symptoms will develop like and in some patients the patient will be experiencing symptoms like headache. That is also very severe headache, and blurred vision, dizziness, nausea, vomiting, fatigue, confusions, chest pain, shortness of breath, dyspnea, that is, and papilledema, irregular heart beat will also be experienced by the patient. So these are all the clinical features that is experienced by the hypertensive patients. And yes. Coming to the diagnosis, it is very simple. History collection, physical examination. So initially when the patient is coming to the clinic or the hospital, we'll be putting a set of questions to the patients, that is the clinical features that is experienced by the patients, and medical history of diabetes mellitus in case it is present, and complete blood count will be analyzed, and chest x-ray, ECG will also be taken to rule out hypertension. Yes. And coming to the management, it is further divided into in case of diabetes, we'll be giving a dietary advices like diet like a DASH diet will also be given. That is dietary advice to stop hypertension kind of diet will be prescribed to the patients, and dietary sodium reduction will also be educated to the patient, and the cessation of alcohol, cessation of smoking, exercise and stress management, weight reductions kind of stuff will be educated to the patient in non-pharmacological management. Whereas coming to the pharmacological management, certain drugs will be given to the patient to reduce the hypertension. So such drugs will be diuretics. For example, furosemide is a kind of diuretics will also be given, and in some patients beta blockers will be given, that is atenolol, prolol, and whereas in some patients alpha blockers will also be given, that is Prozac, and whereas in some patients vasodilators, since vasoconstriction is the cause of hypertension, we will be giving vasodilators to the patient. Sodium nitroprusside is also an example of it, and AZ inhibitors, ramipril will also be given, and in some cases calcium channel blockers, verapamil, amlodipine, nifedipine kind of drugs will be given to the patient. So this is all about hypertension. I hope this would help you. Thank you.